Good afternoon. My name is Carlo Vasquez, Health Educator with Stanislaus County Public Health. This is a COVID-19 update for Wednesday, February 10th. This video will also be posted in Spanish on the Stan Emergency Español Facebook page. Stanislaus County has recorded 48,184 cases of COVID-19. At the time of this recording, 881 people have lost their lives in Stanislaus County due to COVID-19. We send our deepest condolences to everyone who has lost a loved one. Currently, 188 people with COVID-19 are being hospitalized. Of that, 36 people are requiring intensive care. This graph displays Stanislaus County's new daily cases, seen in the vertical blue bars, along with our county's COVID-19 hospitalizations, represented by the red line. As you can see, new cases and hospitalizations are beginning to drop slowly, but the amounts of new cases per day and current number of people being hospitalized remains critically high. So, even though the numbers are improving, we must continue to do everything we can to limit the spread and reduce the number of people being hospitalized. We all need to continue safe behaviors to limit the spread and keep us moving in the right direction. Stanislaus County remains in the widespread purple tier. This is the most restrictive tier and still requires many non-essential indoor business operations to be closed. As of February 6, places of worship are now allowed to have indoor services with modifications. Places of worship that hold indoor services must do so at 25% maximum capacity. Stanislaus County's statistics are much higher than what is needed to advance to the next red tier, which would allow us to reopen more of our local businesses. Our current adjusted case rate is 33.7 and must be below 7. Our current testing positivity rate is 9.7% and needs to be below 8%. Stanislaus County is moving in the right direction, but the rates of COVID-19 in the community are still very high and is still considered to be widespread. That's why everyone is still encouraged to stay home as much as possible and limit their activities to those that are essential, like going to work or grocery shopping. The California Department of Public Health reports that over 55,000 doses have been administered to residents of Stanislaus County. This number includes first and second doses. Both the Pfizer and Moderna vaccine have been distributed here in Stanislaus. Currently, individuals identified in Phase 1A, Tiers 1, 2, and 3 that live or work in Stanislaus County, and anyone 65 years and older who lives in Stanislaus County are eligible to receive their vaccine. If you are included in one of those groups, you may go to a public health community vaccine clinic to receive your vaccine. This week, we have clinics in Modesto, Turlock, and Oakdale. Modesto Central Plaza is open this week, Monday through Friday, from 9 a.m. to 5 p.m. This week, Modesto Central Plaza is administering second doses only. California State University Stanislaus will be open tomorrow, Thursday, February 11th, from 9 a.m. to 5 p.m. and is administering second doses only. Gladys Lemon's Senior Community Center in Oakdale will be open on Friday, February 12th from 9 a.m. to 4 p.m. and will be administering first doses only. No vaccines will be distributed in Patterson this week. No appointments are available at this time, and doses will be administered on a first-come, first-served basis. If you come to a clinic, please bring proof of residency or employment within Stanislaus County, and bring your vaccine card if you are returning for your second dose. We encourage all residents to follow Stan Emergency on Facebook and Instagram, and regularly visit our website to receive the most up-to-date information. You may also call our toll-free vaccine clinic info line to hear updated information about the vaccine clinics. This number is 1-833-954-3566. The recording will be updated every week as soon as the new clinic schedule is set. We wanted to address some of the frequently asked questions that we have been receiving. First question, can I choose which vaccine I receive? Due to limited vaccine supply, People are not currently able to choose which vaccine they receive. Both the Pfizer and Moderna vaccines are very effective and have very similar side effects. If you're receiving your second dose, you will receive the same vaccine as your first dose. Second question, when and where do I receive my second dose? You will receive your second dose at the same location you received your first dose. If you received your first dose at the Scenic Clinic, please go to Modesto Central Plaza. Your date for your second dose is located on the back of your vaccination card. It is important for you to come back for your second shot on this date. If the date on your card falls on a weekend, you will receive your second shot at a vaccine clinic the following week. Third question, are the vaccines safe? Yes. Some side effects, including but not limited to fever, sore arm, and tiredness, are normal and expected. While some people have died after receiving a vaccine, each of these incidents are thoroughly investigated. And none of those investigations have found that the deaths were caused by the vaccine. Severe allergic reactions are incredibly rare. They only happen in about 2.1 to 6.2 in a million people. Also, vaccination sites have the tools and know-how to treat severe allergic reactions. If you have concerns, please consult your healthcare provider. Answers to more FAQs will be available on our FAQ document on schsa.org/coronavirus/vaccines. The FAQ document will be released in the near future. If we continue to work together, we can end this pandemic. Remember that whether or not you've received your vaccine, it's still important to stay home as much as possible, especially if you're not feeling good. Wear a mask when you're around other people. Not gather with people who aren't in your household. Wash your hands often with soap and water. Get tested if you're feeling symptoms of COVID-19 or you think you've been exposed. And get your vaccine as soon as it is your turn. Thank you for watching today's update. Please continue to take care of yourself and your community. Thank you, and take care.